Hafa everybody. I'm Jason Salas. Here is Dr. KristiAnna Whitman from the Guam Behavioral Health and Wellness Center. We are talking about men's mental health, Doc. Very good to have you here.
Nice being here also, thank you.
Right, and men's mental health, I know on social media, it's a topic that's coming up. It's starting to bubble up and trend, but certainly a concern because it's being both praised and criticized because people are saying, you know, as men, you're taught to, especially here on Guam, you're taught to either suppress or repress feelings that you may have of inadequacy or weakness or stuff like that, and, you know, just deal with it later or toughen through it. Men now are learning the emotive benefits of being able to say, hey, I have some sort of feelings and I need some help. So, you know, like, what are you seeing as far as how that's being played out in society?
Yeah, thanks for bringing this up because it's a very important conversation, and it's something that we've tried to figure out, you know, how to work with. I specialize, as you know, in suicide prevention work, and that's kind of the area that we try to my program tries to promote and work toward. And on Guam, unfortunately, we do have high rates of suicide to begin with, but disproportionately higher rates for our men on the island.
Is that because it's a compounding problem? Because we're not supposed to say
absolutely.
Something's wrong with me,
I mean that's
help.
what we can imagine, right? And so, but it's really difficult. So, you know, we look at that problem when we think we want to access, you make sure that our men are accessing services, but it's so difficult, you know, culturally for our men to like feel comfortable accessing those resources and that support. And so we try to find different ways to promote normalizing getting that help we need. We did a video on social media about a year ago that we try to like post again every now and then. What starts with like one of our staff members really starting with like, you know, man up, and, you know, kind of uncovering this idea of like, how can we, you know, unpack that, you know, manning up is actually getting the help you need so you can take care of yourself and taking care of your family, right?
Is there anything more manly than that? Than
exactly,
being able to take care of your kids and your wife?
Exactly. So how can we reframe that narrative that, you know, it's not manly or it's emasculating to like go and get help and not seek help?
Interesting.
Yeah, so that's sort of what we're trying to do in our spaces, but we're always looking for feedback, like what can work, what's helpful, but it's really challenging to kind of go against them, you know, like it's, you know, years and years of stigma, right? And so this men's mental health movement, I guess, if you will, is interesting, you know, to see how it's unfolding, and different spaces are trying to tackle it in different ways. You know, there's certain states that have utilized a lot of humor, right, to kind of get people into therapy offices. Other places utilize like barbershops, right? These real like strong cultural spaces where they train barbers, right, especially in historically Black communities to no signs of suicide, no resource or have resources on hand to get help for the people who come in, because they're typically the first line of kind of defense, right? If you know,
environments that are safe spaces with open conversation.
Yeah, absolutely. I went to one conference setting where they were teaching like bartenders how to uncover or learn the signs of suicide, so that, you know, the bartenders, because, you know, typically that's how our men are masking their feelings, right? And those are the spaces where they start to let loose, maybe, you know, they're not gonna, their first space isn't gonna be to go to a therapist, unfortunately, right? So those are some of the things that we're seeing right now, is like, how can we be more creative about places where we can promote normalizing men's mental health and accessing those services.
That's absolutely interesting, because again, like, I saw this come up on social media, and you were the first one I reached out to, because I was like, okay, we have to talk about this. This is happening. I had no idea that this was as prevalent as it is right now. So what do you in the scientific community want to see as far as, you know, we can make studies, we can make messaging and everything like that, but once they're out, you know, now with the scientific method and everything, we have to measure effectiveness.
Absolutely, yeah. So, I mean, one of the ways we look at effectiveness is on access. How many men are actually accessing services? And then from there, how satisfied are they with regards to resources? And like for me, especially, like impact looks like, we think of success as, are their suicide rates lowering or lessening? Is that the best way of looking at success? Maybe, maybe not. But for me, you know, as a researcher, and especially I think on our island, I think if we're seeing like the fewer suicides, you know, we'd love to be aspirational, say 0 suicides on this island. But that would be like the strongest measure of success, is for our men know that there are places where they can get help and resources versus taking their own lives, you know. So in my in my perfect world, that would be my measure of success, would be that we're not seeing suicides on the island. We're not seeing, and we're seeing people, our men especially, accessing services, whether that's calling 988, whether that's getting professional help through counseling, or maybe, even maybe not needing that help and going through more prevention programming, getting involved in the community and, doing some other things that are even not necessarily, or are at least promoting different skills for themselves so that they can build up build up their self-esteem or whatever issues that they are having so that they don't need therapy. Or
well, if I may,
services.
I certainly am not the scientist that you are, but if there's one thing that guys are very, very good at is if we try something as men and something works for us, we make sure to spread it like wildfire, and it goes without the male community.
Right, and I think that's an important thing to notice also, is that we also look for people who are like us, right? So if we see
dudes educating dudes.
Exactly. So I think that's where we went with that social media campaign. We had a young man who, to kind of promote it, to be the spokesperson. It's different if a female is doing it. We want a man to be telling other people this is okay to do this. How can we? And we've been trying to be a little bit more intentional about promoting mental health services in spaces that are maybe more traditionally male. So recently we did our Guam Football Association talks with both men and women, but those were conversations we really wanted to have with our young men, especially, and hopefully moving forward there are more spaces where we're spreading that kind of messaging in spaces that are more traditionally men. We're doing more work with our farming and our agriculture community also.
Very nice.
Yeah, so that's also a traditionally male space. So
I can see that also being like an industry and a space that can be very, very, very isolated, obviously very lonely. You're out there working in the field oftentimes by yourself.
Yeah, absolutely. That, and then also the construction space. So so those are two different areas that we've gotten actually inquiries, and I've actually personally gone out there and put on a construction hat and promoted 988 at job sites, because their employers had said that they wanted to make sure that those, especially our off-island workers, and have the access and have the resources to help. And those are, again, traditionally male spaces. So I guess if there's anything that I want to promote and share, is that hopefully we can spread these images and normalize these feelings that it's okay, man, woman, whatever, right? To get the help that you need, and there is help available for you.
There you go. Well, my fellow guys out there is nothing wrong with being in touch with your emotions, openly expressing your emotions to a trusted friend, a learned professional, to a loved one. The word's getting out there. We're supporting each other, but 988 available 24/7.
24/7, 24/7, and we're about at our second anniversary of 988. We're having thousands of callers over the last 2 years. We've saved many lives, and we want to save many more and continue with that. So we have all sorts of people answering the phone, men, women, and so we encourage you to call.
There you go. And as a good doctor said, man up. That's the word. Thank you, Doc.
Thank you so much, Jason.